Hey, it's Dr. Hannah with this week's Hot Topic. Today I want to talk to you about something that hopefully doesn't apply to a lot of you, but I know that it does for some because we've seen you after you've been in a car accident. So today I want to talk to you about car accidents and what to do. First things first is if you get into a major car accident, make sure there's ambulance at the scene. Most likely if it's a major accident, somebody has seen it and they've already called 911. But in worst case scenario, if you haven't and you feel like you need to go to the hospital, go to the hospital. Don't play it off like, oh, everything's fine. You don't want that oh crap moment that something's not right later on. So it's better to be safe than sorry. So if you have to go to the hospital, just go to the hospital. That's kind of, it goes without saying, but again, I do have to say it. For some people, they think they can be, everything's fine, no big deal. But again, if everything doesn't feel right, just go to the hospital. It's better to be safe than sorry. So on the other side of that, if you've been in a car accident and everything seems like everything's fine, you still want to call the police to the scene because they'll make an accident report for you. It'll make your life so much easier later on when you're dealing with your trying to get your car repaired or if you have any medical expenses or anything. So make sure that you call the police to the scene. They'll write an accident report, and then that'll be something that you can use later on. Most of the time, people who've been in a minor accident, they feel like everything is a-okay. They're like, oh, well, I just have some stiffness. It's not a big deal. I'm fine. That's when you don't want to just blow it off like no big deal. So right after you've been in an accident, and if everything else is okay, that you didn't go to the hospital, or even if you did go to the hospital and everything is still fine, come get adjusted right away within like 1 or 2 days of that accident. It's gonna make your life so much easier in the long run if you get adjusted right away versus if you wait a week or two before that whiplash, that soreness, that stiffness kind of sets in. Because for the first little bit, because of that adrenaline from the accident, you're not gonna feel anything. You're gonna feel great. You're gonna think nothing's wrong. But that's the time to come get adjusted because again, it'll help you feel so much better and not have those major issues later on down the road. So what we're gonna do when you've been in an accident, make sure if you call the office to make your appointment, make sure you tell us you've been in a car accident. We're gonna do a re-exam on you to make sure that everything's okay. And then ideally, our main focus is gonna get you back to where you were before your that car accident. Cool thing about it is most of the time that people who have been and they're existing patients, we know what you were like before this accident. So that's what we're trying to get you back to, is life before the car accident. And then we'll kind of go from there, we'll reassess. Everyone's different. Usually the first 2 to 3 weeks, if after an accident, is usually the worst. So you kind of feel kind of crummy, a little run down, super sore, like you've been beaten up or you've had a whiplash, basically. Totally normal. Again, that's what we want to get you through. And by getting adjusted right away, so not waiting after you've been in an accident, is going to be the best thing for you. That's all I have for you today. We'll see you guys next week.